May mga program. Kasi hindi naman ako gumawa nito, so... Okay. We have the speaker's profile right on your BOA, Book of Abstracts. So Dr. Don Lucero Frisno III is an associate professor of public health at the Department of Public Health of Liverpool University. Before joining the university, he was with the Master of Public Health program of Department of Public Health and Policy of the University of Liverpool in the UK since 2009, where he remains as an honorary lecturer of public health until the present. He is also affiliated with the Faculty of Management. Is he there? Yes. Okay. Don has published in the fields of global health, public health, and scientific journals. You type his name, he's everywhere. Ito po yung mga isang type mo lang nandiyan na sila sa Google. So, you can read much of what he has. And now, I think we have a call. You have to face the computer. Hi, sir. Hi, sir. There. There's your audience.
Hi.
Say hi to Dr. Don.
Hi, sir.
Can we make it louder, please? We'll just fix the sound.
Okay, I'll do my best. Can you hear me?
Wait, sir. Sound. Sir, can you...
I should look at
There.
Am I handsome enough?
Yes!
Okay, that's a good idea.
We have already introduced you, so we're ready when you are.
Okay, so good morning, everyone. I understand the Philippines is going through some issues with the earthquake, and luckily, good that we're continue this workshop. So I understand you have my slides.
Yes.
Is it on now?
It is.
Okay, let's just make this a bit informal. So when I say informal, I have my cup of coffee. Okay. Just if you have any question, raise your hand or just interrupt me anytime. And I'll try my best to answer. And we'll have a workshop later on after this presentation. So what we're going to discuss this morning is trends in global health research. Of course, for most of you, probably global health is something new. Maybe you've heard of it before, but you might not have a grasp of it. Actually, many people are interested with it, but they don't know what it is. So, but before that, I would like to introduce myself. Second slide, please. So I teach with the London School of Hygiene and Tropical Medicine. I teach in the MSc in Global Health Economics. And I've been teaching with the University of the Philippines with their Master and Diploma in International Health. So that's with the Open University. That's the only international health program in the country which is online, 100% online. Of course, now I introduce the term international health. The first question that you will ask, what's the difference between global health and international health? Why are some programs are called global health? So there's a one-year program at Oxford University, which is MSc in global health. And if you will study in Australia, they will call it international public health or international health. If you study in North America, sometimes it's global health. If you study at London School of Hygiene, you will call it Master of Science, Health in Developing Countries, something like that. So we're going to define that and differentiate it, compare it with public health. So I understand most of you are in the field of health, so you have a good grasp of public. teaching with the University of Liverpool for 10 years. So actually now I'm on sabbatical. I'm just doing research. So we have 4 campuses. We have one at Liverpool, one in, we're the biggest online university in Europe. Our MPH program has 1,500 students, and most of who are would come from the WHO. So nowadays, education is a bit, well, has evolved. So there are many online programs. So people who are working for the World Health Organization or the UN, they don't want to leave their jobs. So that's why no job, no salary. That's how it is. So that's why they prefer doing online. But now there's no major difference. I mean, except for delivery, there's no major difference between the content of online, and you can ask me that later on because we can discuss global health education. And I do a lot of grassroots work. I founded and manage the Global Health Focus. We aim at developing critical thinkers, leaders, and researchers in global health. So that would be some researchers. And I'm the managing editor of Global Health Research and Policy. So pretty much I have been in global health for a long period of time. And that's being a researcher, an academic, and editor of a global health journal is a bit challenging because there will be lots of researches being sent to us, and people will argue if we reject articles and we say that this is not global health and this is not in our field, then we get a lot of discussions and debate, if not fights. So sometimes we get into fights also. Okay, you've heard of global health, right? Yes? Yes, you have heard of global health. It's a hot cake topic. Everyone's interested with it. Everyone loves it. Everyone likes it, but no one understands it. So people will do, I will always receive questions, should I do Master of Public Health or should I do an MSc in Global Health? Should I do an MPH in International Health? There are different sets, and for some of you who are teaching, I have a different lecture on global health education, but that would be for a different topic in a different session. We'll just focus on trends in global health for this session. So maybe we define first what global health is. We all know what health is. You've been here, the definition, you've been using the definition proposed by WHO. And of course, global, it's very easy word. When you put them together, that's what makes it interesting. So, fourth slide now. International public health. Okay? So before, we would have the term public health. I will not define it here, probably because most of you are knowledgeable about it. So when we look at public health, we look at the community. We look at the determinants of health that will be influenced within the community level and how the person interacts with the community. But always remember that health is a personal issue. So at the end of the day, we always look at health as NCDs, diabetes, hypertension, depression, mental health, or infectious diseases, HIV/AIDS, tuberculosis. So it's always a personal issue. However, later on, I'm going to show you that even if it's a personal issue, there are many determinants of health. And as we go through the different determinants of health, within the community where one person lives, so you have the environment, you will have pollution, for example. You can do research on that. That's public health. You will have problems within the company. then that's occupational health. You have the different hazards within a community, for example, in the Philippines, typhoon, earthquake. These are environmental hazards, and they result into health issues. At the end of the day, the health issues will be, for example, injuries after earthquake. And then you also have injuries like car accidents. Car accident will be a very interesting research, which remind me later on to discuss further. When we look at principles of public health, and we look at health problems and challenges that affect low and middle income countries, with the global forces that influence health, earlier they defined it as international public health. Okay, this will be a bit tricky now. So you have community forces that influence health, but when you look at the bigger perspective, such as, for example, Filipinos who will go to the Middle East and they do not have access to health services, it's not anymore community influences, but it's now at the international level. Between two countries, they will define it as international public health, because the determinants of health now will change. If migrant workers in Hong Kong, our domestic health workers, our health workers in the Middle East or in Southeast Asia, when their health is affected, and forces that affect it becomes a bit at a higher level, at the international level. For example, lack of cooperation and health services between Singapore and the Philippines. That's not anymore in the realm of community health or public health. Then it becomes a bit international public health. So earlier we used that term. Later on, universities, researchers have shifted the term international public health to global health. Okay, next slide, please. So what is global health? Okay, health problems. So any health problem, whether it's cardiovascular diseases, road traffic accidents, Zika, Ebola, these are all health problems. I think we all know that. Issues, for example, issues and concerns, we put them together. For example, whenever we talk about global health, we always discuss about Africa or the poor countries in Asia. Some of the issues that arise there are, for example, if many of you will become consultants for many health research work in different countries in the future. As you become good researchers, because you are good with it, you'll be sent to other countries. But when you travel to other countries, your salary goes higher. But if you work in the Philippines, it's a bit lower. And if you work in the field of health, for example, what do you think is the former head of the World Bank is a medical doctor? That's a big global health institution. If you work for WHO, salaries would be from $5,000 per month to $10,000 to $15,000 per month. And then you assign people from WHO who will go to the Philippines. In fact, they are doing the same thing. And why do you get only 20,000 pesos per month? So that has to do with health worker migration also. There are pull and push factors. So these are the issues and concerns. For example, with Haiyan in Eastern Visayas, there was a big amount of money that was poured into the Philippines. But where did the money go? Much of it went to human resources, consultants, instead of the population. Money that moves from one country or another is an issue and concern in global health. So anything that has got to do with that transcend national boundaries would be an area for global health. For example, as I said, when people migrate, let's say, for example, in Syria, they all went to Europe. They brought in a lot of new diseases, So when you say new diseases, the receiving countries will not be able to handle these diseases because the doctors in Europe are trained more towards non-communicable diseases. But if you bring in a lot of tuberculosis, then there will be a resurgence of tuberculosis, then you have medical doctors. So these are the issues and concerns that transcend national boundaries. What is important in researching global health is to understand the determinants. For example, the circumstances or experiences in other countries. Why are during the when I was doing my PhD at Cardiff University, my work was on HIV/AIDS in the maritime industry. No one was interested with that because I would come from the Philippines, I was interested in HIV/AIDS. My first job was with the Department of Health European Union project on HIV/AIDS. I wanted to look at seafarers, not only Filipinos, and why they are at very high risk HIV. Why is it when they go abroad, they contract HIV? Because they don't use condom. And what are the global forces that influence this risk? So now I'm looking at the international determinants, global determinants, being away from home. So for you who are social science researchers, theory is very important. For example, why is it, now that I understand that many of you come from the provinces, but when you are away from your places, you have a different mindset. So you are in a liminal stage, liminality. Therefore, if you are a father or someone who is away from the family, you have a different culture, and all the rules and regulations do not anymore guide you. So you become prone to HIV/AIDS because you can now do anything. So that's the same with tourism. There's a reason why seafarers, when they are away from home for 8 months.
Oh no.
And because they want to simulate the situation with being, I hope there's no wife there, a seafarer. When you want to simulate a relationship which you miss from home, being away for 5 years, you try to meet someone in the bar. So my field work was in Brazil. I was there for 1 year. Research, by the way, is always fun. So don't think of it as something bad. It's something you can have a good profession and good money from, and also it really creates something with you. I mean, you become known if you have a very good research area. Anyway, so when the seafarers are away from home, they try to simulate the relationship between husband and wife because we're humans. We love relationships, and because within a relationship you don't define it by using condom, so they don't use condom. So that was one of the findings of my research. And the women also act like wives. They provide care and support, especially emotionally. And so the determinant here is that the mobility and also the contracts of seafarers were actually based on international agreement. So this is where global health comes in. When you have a health phenomenon, for example, HIV/AIDS among seafarers, it's not simply that someone has sex with a sex worker who has HIV/AIDS. It's beyond that. So if you elevate it to the global health issue, for example, because of the world trade, we now have to deliver goods, all the things that we import and export, in big volume. For example, a lot of soybean, because China likes eating soya, so they would import more soybeans from South America. You don't use small ships. You will use big ships. Therefore, Now, most of our ships are really, really big, so that trade will be fed. All the cars that will be imported by Europe will come from Japan. And with one trip, you can carry a lot of goods. So we are now looking at international global forces. Now, because many countries are becoming richer, labor becomes more and more expensive. So it is actually wrong to say that, oh, I'm going to the US because I'm going to get rich. I'll be rich. True, in terms of money, it will be you will get a lot of money. But the standard of living there is very, very expensive. You earn a lot, but you have to spend a lot. So if you will see now, the birth rate of many countries is really going down. Okay, going back to the seafarers. So because labor becomes very expensive, there is a shift of labor from richer countries to the to the developing countries. And one of them is the Philippines, because we have good English. So the most number of seafarers comes from the Philippines. And because they are not fully hired, they would go on and off contracts, and we want them to stay longer on board ships for one contract so that the maritime industry will be able to save money. Because of that long contract, they stay away from their families for a long period. With, let's say, a Danish seafarer, they're hired full-time. They have 3 months on board the ship and 3 months with their families. 3 months again on board and 3 months with their families. You do this with the Filipinos, 8 months to 1 year, away from their family. They go back home only for 2 months. Multiply it for 20 years. How long do you think will be their sex life be? Shortened, right? So what I'm trying to say here is that there are global forces which will impact on HIV/AIDS of the Filipinos. But doing the causation between these global forces and health will be a major issue in research. Because is it really that drives? But the good thing with this kind of research is that it impacts on global health policy. For example, one of the impact of my research is that it influences the mobility of HIV/AIDS. So you will have truck drivers in Africa who will drive from the inner part of Africa to the ports. The transmission of HIV/AIDS will be transferred from, let's say, for example, in DR Congo, it will go to Mombasa, Kenya, and then in every hub there is sex work. There's always, wherever there are migrants, there are always sex workers. And then the transfer of HIV/AIDS will go to the seafarers, and then the seafarers will move around the world, and it will move the virus. That's the reason why most of the first HIV cases in many parts of the world, what brought HIV to Europe was seafarer. The first few cases, the major few cases of HIV in the Philippines were among the seafarers. So that's what my HIV is. I'm just trying to show that as an example of the circumstances or experiences and how these determine health. Okay? So more or less, you now have a grasp of what global health is. And the important part is when there are problems, there should also be solutions. So that's why the last few words of this definition is cooperative actions and solutions. Okay, this is very important in global health. For example, Hayan or Yolanda, we gathered a lot of funding and help from all over the world. As compared to Nargis in Burma or Myanmar, they did not allow development aid. So it is not necessary for countries to give aid, but because of agreements that part of the income of countries should go to development aid, that's the reason why we have to give. There's a norm to give development aid to the developing and poor countries. For example, China is now becoming rich. We are now shifting them to become donors, to become a donor country instead of a recipient country. So that has got to do also with your scholarships. China is not given any more scholarships because they are rich, they can afford. That will happen to the Philippines, wherein there will be fewer scholarships for you in the future, unfortunately, because we actually now have many scholars who came back. And therefore, this is a chance for our own universities and institutions to become really very good universities and world-class, because we will train our own people. We are now at 510 million, and education is still very important in the Philippines. Okay, so cooperation is very much needed. Let's say, for example, you are in a community. There's the rich, and then there's the poor. Why do you think, maybe I should ask questions, so I will hear from you. Why do you think should we help the poor? Just shout so I can hear. It's very easy. You're all working in health, and why do we have to help the poor and make them healthy? Okay, that's one question.
The resources will be depleted. The community's resources will be depleted if...
Therefore...
okay. The community's resources will be depleted if there will be more poor in a certain community. So instead of making use of all those resources for the poor, some rich community members can put into their own resources so that they can subsidize what is needed.
What is the benefit of the rich to help the poor?
They are workers.
Yeah, workers.
Because they are the workers.
Worker, very good.
Yeah.
In other words, that's utilitarian reasoning. They are the workers. They will work for my company. That's economic. Give me another reason why we have to help the poor.
They are the majority.
They are the majority. So, I'm the rich. I have most of the wealth. What do I care? Let them be. Why should I help them if they are the majority?
Because they feel that they have a moral obligation to help those who are in need. Because there's a word.
Very good. You use the word moral obligation. So that is what you call moral reasoning. Humane, humanity. Any reason, another reason why you have to help the poor? Anything, any stupid reason would be okay. We'll try to dissect it.
Compassion to be empowered.
Why do you have to empower them?
So that later on they will become self-reliant.
Why do you have to make them self-reliant? What do I care if they have to be self-reliant?
Productive.
Very good.
From me.
Again, utilitarian, productive. They will produce goods, and when they produce, they have an income, and they can buy the goods and services of those who are rich, so they are the consumer. Improves the economy. As the economy goes better, the country goes better economically. Okay, any other reason?
For social
What did the Bible say?
Pero siyang keynote speaker natin.
What did the Bible? What does the Bible say?
charity.
Why do you have to do charity? Why does the Bible say help the poor?
Give more to those who share blessings.
Very good. Very good point. Those who are poor should give more because they have more blessings. And what is the term for that?
Blessed are those who are...
What is the word for that? Those who have more should give to those who have less.
Shares.
Equity. Equity.
And equity is a major principle in global health. Going back to the religion, that is what you call religious reasoning, because it is what God wants us to do. In any religion, everyone says that. Okay, so we have utilitarian reasoning, they're the consumers, they're the producers. Public health reasoning, why do we have to help the poor?
They have less capabilities. Less
Maybe
resources.
So what if they have less capabilities? Why will we treat the people, for example, at PGH, where I did my med school, why do we have always a lot of poor people there and we have to help them? In our provincial hospitals, why do we have to give, I am in the board of the World Surgical Foundation, we give free surgeries to the population. Why do we have to do that?
Less fortune. Less
Economic.
Because they cannot afford to provide
Yeah,
for their
okay,
needs.
if they cannot afford, I'm a rich doctor, I don't care if they can. Oh yeah, I heard someone is from the doctors to the bar. Why do we have to do that? Why do we have to treat the population? And remember, determinants of health say that most of the ones who are in health issues are the poorer ones, right? That's a determinant of health. Why do we have to do that?
Service.
If they have tuberculosis, where will it go?
Yeah.
to avoid epidemics.
Epidemic.
Yeah, because you're all
It
part
will
of one community.
transfer to the rich.
Yes.
And infectious disease will transfer to the rich. There's an obligation to really keep on helping the marginalized. Any other reason why we have to help the poor?
You want to help
So that's
people for
public health?
self-fulfillment.
Self-fulfillment, okay, you're rich. So that's saying also that you have more, therefore you help, okay. That's a bit spiritual, moral.
You want
What about the United Nations? What did it say? What does the United Nations say? Why was United Nations established? What's the central tenet of the United Nations? United Nations was established because of human rights. The right of the poor to be helped. Okay, we now have many reasons, right? What else? Any other reason? So public health, so that diseases will not transfer. If they are healthy, they become workers. You have religious reasoning, you have moral reasoning. What happens if they are poor? What happens when people are poor and they have no access to food? And
crime rate.
Safety.
crime, very good. That is what you call security.
Security reasoning.
Security reason. That's why there's what you call a field called global health security. If you do not give vaccines to some population, it will spread to the rest of the population. In other words, we have all the reasons, motivation to help the poor. Now, how do we help the poor?
How?
How do we help the poor? What do you do, in other words?
Include them.
Well, I provide services for them.
Education.
I serve them.
Serve them.
I serve them.
Okay, that means provide free services.
Yes.
Agree?
Yes.
Very good. If you provide free services, who pays for it?
Government.
The government. From the taxes. Well, it's a contentious issue if you say it's from the rich, because some rich people do not pay the right amount of taxes. It's mostly the middle class.
Yes.
Okay, how else do we help the poor? Let's look at the different government administration that we have. For example, with Duterte, what are the policies?
Universal health care.
Very good. Universal health care, universal health coverage. How do we help the poor if there's universal health coverage?
By making healthcare available to them wherever they are, whatever their status is.
Oh, okay, that's availability. But when we say availability, as an economist, as a health economist, you always look at cost. There will always be someone who has to pay.
Yes.
So even if people fight free healthcare everywhere, free healthcare does not mean it has no cost. Someone still has to pay for it. Therefore, providing free healthcare to the population will be either from taxes, whether it's from sin taxes, from tobacco, and it's given free, and the money is delivered to the services and it's subsidized. Okay, that's how we help the poor. How can the rich help the poor?
They should pay the right tax.
Pay the right taxes, which means progressive taxation. As you get richer, you pay more because, as what you said earlier, you said you have more blessings, we have to give more. Agree?
Yes. Pay the right
That's what you
wages.
said.
Pay the right wage.
So that's correct.
If we
How
implement
else do we help the poor? How do we help poor students, for example?
scholarships,
Very good. Scholarship is a way of helping the poor. How else do we help the poor? They're very poor. They have no access to health services. Should we give them cash?
No.
Yes or no?
when we do that with the 4 Ps, we
Okay,
can cash.
raise your hand if it's okay to give cash. Raise your hand.
With conditions.
Who said we should not give cash?
With, that's why it's called subsidy.
Most of you say that we should not give cash, right?
Yes.
Because if we give cash, they become more lazy. Agree?
Yes.
Okay. What was the first what was the first experiment by the World Bank that says if we give cash to the poor, the health indicators actually increase or improve? And mind you, we are already doing it in the Philippines with the conditional cash transfer.
Yeah.
Okay? So scholarships, conditional cash transfer, giving free aid, discount to the elderly, these are all policies that will transfer the resources from the rich to the poor, and that is what you call equity. And in global health, we do this because the richer countries are the ones who have the money. They will transfer it to the poorer countries with the same reasoning as what we mentioned. Do you understand now, more or less?
Yes.
Why Bill Gates and Zuckerberg and all these people and USAID, Norway, all these, the poor. Not the poor, but those who need more. So that's why we have been receiving a lot of development aid, because of this logic. The first countries who helped HIV/AIDS in Africa were actually the Europeans. Why do you think were the Europeans the ones who helped Africa for HIV/AIDS when it started coming up?
It's geographically close.
Very good. It was not because they were altruistic. It was because they were afraid that they're the nearest region where HIV/AIDS might move. So that's why they poured a lot of money to Africa. Okay? So that's how, what I'm trying to say here is, as a researcher, that's how you look at health issue from a global dimension. For example, when I was in the Philippines last week, There was a big headline on the newspaper, not a headline, but a big advert, that Toyota sold their 1 million car in the Philippines. I don't know if you saw it. Is it good or bad?
Both.
Why bad?
Traffic, pollution.
Exactly. Very good. You have your traffic, you have your pollution, and most of all, you have your road traffic accidents. From a global perspective, we'll look at the increase of cars. There will be a concomitant rise in the increase of injuries and road traffic accidents. In fact, road traffic accidents will be number 9 as the cause of death in the world. Now we question, why is there a lot of road traffic accidents? If we want to dissect it from a global health perspective, why do you think we have a lot of road traffic accidents? I'm trying to play now with your brain.
Infrastructure.
Because people drive, drink and drive, okay.
Infrastructure. The roads
Infrastructure,
are
bad roads, yes. Because you keep on messaging, texting while you are driving.
bad driving habits.
Yes, okay.
In Philippines, you can get your driver's license easily. So easy.
Most of all, because there is an increase in car and automobiles all over the world. Okay, it will be unfair to ask you why there's an increasing. I mean, why there are more road traffic accidents in countries, in the poorer countries. Why do you think are there more road traffic accidents in poorer countries?
They can get their license so easy.
They can get their license so easily. That also happens in the Philippines. So therefore, their skills are not good. They don't observe rules. The implementation, for most of you, you'll always say it's the implementation.
Safety precautions.
Safety precautions, so on and so forth. From a global perspective, we look at the form of development that we have on why there is an increase of cars all over the world. For example, you are a Korean company. You produce 10,000 cars in a year. 10,000 from the factories. How many should you produce the following year?
More. Double.
Why more?
Increase income, profit.
Increasing income. Agree?
Yes.
Okay. Okay. Increasing income. When you are medical, you just finished medicine, you pass your board, you practice. The first year, you can only see 10 patients in a day, right? Okay. After 5 years of working, 50 patients can be seen in how many hours? Can you do it in half a day? Yes. Because it are getting better. So what do you do? You add 50 patients in a day, so your number of patients will become 100 because your skills got better. Agree?
Yes.
Or if you don't want to work in the afternoon, you go shopping, you go to the spa, you go at the gym. But if you want to keep on working, you add additional 150 patients. How much is the increase?
From 10 to 50?
From 50 to 100.
100%.
Okay. What is the growth rate of the Philippines now?
Population.
In a percentage, you have that number which is a percentage. The GDP, the increase in the economy. I think it's around 6.5. 6.5. That means the economy increases by 6.5% within a year. Okay? And the government will always say we should project to keep on increasing the economy, not because we need more money, but because your skills are getting better. Therefore, we don't want to waste your skill. Okay? So that's the reason why we always peg the growth rate at that percentage. By the way, the highest growth rate in the world, that of China. It went to as high as 15 to 20%, I think 18%. That's a lot of money. That's why they got very, very rich. Let's now bring it to the cars. The car workers will get better. Therefore, they will produce
They're more efficient.
more cars in the following year because their skills are getting better. Okay? So the following year, they will have, let's say for example, they will produce 11,000 cars. Is that okay as a projection? The third year, will they produce more cars? Yes, because it has to be positive all the time. On the fifth year, they have been selling cars in the country. Now your country has a lot of cars. What policies will you do so that the factories will keep on producing the same number of cars, or else your workers will stop working? What kind of policy? Okay, it's unfair to ask you this because we don't have a car industry in the Philippines. You bring in your old car for 5 years already. You buy a new one,
Okay.
and then we will give it to you at a cheaper price. Because one of the reasoning for this is for the factories not to stop producing cars. Okay? Now, you have all these old cars. Where do these cars go?
To the developing countries.
Exactly. So if you will notice, many of your Mercedes-Benzes in the Philippines, many of your expensive BMWs, numbers.
Yeah.
They are the ones discarded by the rich countries and sold to the poorer countries. And you will see a lot of this in Africa. It's not only with the cars, but also with the ships. Have you been on board with an island-to-island ship in the Philippines?
Yes. Ro-ro.
What do you see there inside?
Cars.
I mean, what the signs? There are even vending machines in Japanese.
Yeah, Japanese.
There are signs in Korean. There are signs in Chinese because these are old
Yeah.
ships sent to the develop. And this is one of the reasons why there's an increase in. Can you still hear me?
Yes.
Okay. There's an increase in road traffic accidents in many developing countries. So what I'm trying to show here is that there can be causation and linkages between global forces and health issues. So that is the frame of mind, the way of thinking that you have to develop when you have to produce research in global health. It is not easy because you have to do a lot of reading, just like in any research. You have to use a lot of theories, like for the examples that we gave, we provided economics, development, and other. That's why global health is a multidisciplinary issue. So if we go to the next slide, please. If you see the next slide, we are now defining the differences between global health, international health, and public health. Column, global health will use a lot of disciplines to be able to explain health issues. And so as, of course, public health. And if you look at access, you look at health equity as a global issue wherein poorer countries would need more and richer countries will give more. Does equity sound something else? Does it ring a bell? Where do we get, you said, I am blessed, we have to give more. It is saying the same thing as from each according to his capacity, to each according to his need. Have you heard of this phrase? Where did we get that phrase? From each according to his or her capacity, to each according to his need. Which means if you are richer, you give more. If you are poorer, you get more.
Biblical.
Is that biblical?
No.
Yes.
Yes, it is.
Parang an anti-word.
Okay.
New Testament.
Social theory that espouses that
Hindi naman Marxist.
starts with letter C.
Confucius.
Now, another
Communism.
very good.
Okay.
That is actually equity
Marx.
is flattening everyone, but actually that's the concept of communism, right? Equity. Now, do we still have communism in the world? Yes or no?
Yes. But it's now called
We have a part which is socialism. Okay? In fact, where's communism, by the way? Where else can you see communism?
There. North Korea. With you. North Korea.
China.
Socialist.
Ah,
1 second. Oh, break.
Pinatok na.
Why are you talking to yourself? Are we still okay?
Yes.
We're really fortunate that he gave us his time. So there.
And a package. Go ahead. How is it so far, the lecture?
Good.
Okay, you'll love it more when I'm face to face with you. You'll be awake from 8 to 5. Okay, should I continue?
Yes.
Okay. There's another social experiment which is global that fought against communism. What is that? That's another C.
Capitalism.
Very capitalism. Why I am introducing this is because these are all global forces that influence our healthcare. Okay, now, why? Yes, you mentioned that China is a communist country. Is it a communist country, yes or no?
Socialist.
By idea, but by economic.
They only have a communist party, but they are highly capitalist.
Okay.
That's why they are the ones producing all the goods in the world. In fact, European countries are more socialists than these so-called communist countries like Vietnam.
Vietnam.
Okay, so why do we say France is a socialist country? Because in France, it's cheaper to study than in the Philippines. You don't have to pay any tuition fee. In Norway, you don't have to pay any tuition fee. That's a socialist perspective. Remember, to help, not for them to pay. That's a socialist perspective. That the government provides all the services. In fact, Philippines is still highly capitalist, for example, because it trickled down to all our institutions. For example, by the way, why did we kill communism? If we want free healthcare, everyone wants free healthcare, right? I want to go to my hospital and I want to get free services. But why did we kill communism if it is something good? Let's see if you studied, you're so studied. There was nothing wrong with socialism and communism because we are making everyone equal, providing free services from the government to the poor people, to everyone. Everyone's working for the government. The government before owned Manila Hotel, they owned Philippine Airlines, they owned Philippine National Railway, they owned almost everything. But when capitalism, neoliberal economics came, what happened? We introduced privatization. That's the reason why all our hospitals, all our hotels owned by the government are now privatized. And we introduced cost, user fees, which is part of capitalism and neoliberal concepts, so that we introduced private healthcare with neoliberal economics and capitalism. The world got richer and very, very rich because of capitalism. That's the reason why we have Bill Gates. The more skills you have, the better skills you have, the more rewards you will get. Okay? But what happened with that social experiment? There are only two global experiments which happened, and that is socialism, communism, and neoliberal economics and capitalism. What went wrong with neoliberal economics? Actually, you all know these things. It's just the way you frame the theories within your thinking that will help with the way you write, with your research. Okay, I'll give you the answer. The rich got richer and the poor got, right? The gap between the rich and the poor got very wide. And then we go back again to the usual problem where the poor have health issues because only the rich can pay for good services. So that's the reason why all our policies are trying to bring up the poor and pull down the rich. Agree? Okay, then. So, we try to, well, not punish the rich, but we try to get more from them. For example, travel tax in the Philippines. How much do you pay for travel tax? Why do you have to pay for that? Why do you have to pay for that?
I don't know.
You know? There is always a philosophy between any law or action. The reason why you have to pay travel tax because of equity policy. Only rich can travel, and therefore we have to tax you. And the poor cannot travel, we don't tax them. Why do you have to pay toll fees? Highways.
You have the capacity to buy a car.
Because only the rich can use the highways with their cars. Right?
Yes.
Why do we have to give discounts to the elderly?
They don't, some of them don't work anymore.
Getting income anymore.
Because they have no income, therefore, there will be someone who will pay more, and those are the ones who can afford. Now, why can doctors travel abroad for free to attend conferences?
The medicines that
They're
we
sponsored
buy.
by pharmaceutical companies.
Yeah.
They are sponsored by the pharma companies, and who bear the brunt of the cost?
Yeah.
Consumers.
The cancer patients who are dying and who are poor.
Yes.
You see now what happens with capitalism? Okay. Let's just go further with the slides. For the next slide, where do we get data for global health? So there are many data which we use. For example, the health indicators, life expectancy, maternal mortality, infant mortality rate, or the demographic and health surveys. Macroeconomic data, for example, I'm interested in Human Rights Index and press freedom. I can just do correlations to those two, and I can have conclusions that those who have better press freedom are actually the countries which have higher life expectancy. So these are the things that you have available online. You can look at global health policies. For example, are we following the guidelines on tobacco control in the Philippines? We have demographic data, aging, migration, and of course, global trends. Why is there an increase of TB or HIV? Human resources is a major global health issue. Why do we have so many nurses in the in the US? The migration flow, and what was its impact on the nursing schools in the Philippines? There was an increase in the number of nursing schools the past decade, then it started to go down. So these are some of the resources which you can use. Okay, next slide, please. So this is a framework of my boss, Dow Green. She's the boss at Liverpool. And if you look at the individual person, which is the center of health, I mentioned public health, the yellow line after the circle, the individual lifestyle. What are some lifestyle factors? Smoking, size, so on and so forth. And mind you, diabetes in the Philippines is increasing and so on because of the lifestyle of the Filipinos. Social and community influences. For example, people afraid of going to access health services. Let's say, for example, teen pregnancy because they are ashamed of it, or the spread of HIV/AIDS. Living and working conditions, you have pollution, I mentioned the number, and the general socioeconomic, cultural, environmental conditions. These are now the global forces. If you see the arrows to the left, you can see that it has an effect on the health of the person. So that's what we have been doing all along. Okay, next slide, please. So what studies can I do as a researcher based in the Philippines? Do we need to travel to be able to do global health research based on our short lecture? No need. Okay, agree. Now let's go to the next slide. I am interested in medical education. Maybe some of you are teaching. What topics can I work on in the Philippines as a topic of global health? What do you think? It's supposed to be a workshop that we're supposed to have, but let's just do it as a group discussion.
Human health resources.
Under the concept of human health resources, in what context? We want to make it global health.
If the programs here in the Philippines are globally can cater to the global health needs.
Okay, that's one. For example, ASEAN integration. How are we able to harmonize the medical education in the Philippines? So that's one. Second is, have you noticed we have many foreign medical students in the Philippines?
Yes.
That is mobility of medical education. So I am very much interested to do this actually. So after this lecture, you will get my email, and I will be happy to mentor you and to work with you on a number of publications that we can do for journals. So that's one. What is the motivation of these foreign medical students to study in the Philippines? And what is their acceptability when they go back to their countries as medical doctors? This is a very important global health topic. No one does research on this. This will be very interesting. In fact, here in China, there are like 100,000 foreign medical students. So they are now a major producer of medical doctors from all, and that's human resources for health. Okay, in the interest of time, let's go to the next slide. I am interested in migration and mobility. What topics can I work on in the Philippines? From a global health perspective. We have a lot. We have migrant workers.
And health. Their
You
health.
can look at their health issues when they come back home.
Yeah.
You can ask them questions. What are the issues and challenges that they have abroad? You can ask them if they have access to health services. Seafarers itself was my major topic, and no one was interested with it. And by the way, one advice: to be different, the field of research, do not go into fields where everyone is. Everyone is in HIV. Everyone is in TB. Go to unique areas.
Yeah.
I mean, you can continue doing major health research, but you can have a niche area. For example, my niche area is maritime health, people working on ships. I was the only one from the Philippines, more or less, doing a lot of work on this. So being submitted to a public health journal.
Okay. So,
A comparative analysis of is it measles now?
measles,
A comparative analysis of the measles epidemic in the Philippines compared to other countries. That's a global health perspective.
Okay.
You don't have to go abroad. You just have to look at the online resources. What other health topics?
Dengue vaccine, that's for that.
Universal health care.
Universal health care. We have a paper. We compared it with Southeast Asian countries. That's one. That's global health if you do a comparison. Mobility of human resources within Southeast Asia. I'm doing a research now where we count the number of nurses and doctors produced in the Philippines and looking at the needs of different countries of Southeast Asia and how they can plug the gaps. So that's one. You have to be creative when you think of research. There are very interesting topics which we try to forget. For example, urban health. That's a major topic in the Philippines. Disasters. Okay, for the next slide, we're almost done. So these are some of the global health topics. Climate change. So climate change is a major global health issue. Aging. Why is aging, by the way, a major global health issue?
A lot of people are getting older already, and the resources for them is, there might come a time that resources for older people might not be sufficient.
That is the impact on the individual person.
Yeah.
So, for example, is the Philippines following the international guidelines on frameworks aging? So, aging is a major problem because most of the societies in the world, especially with Japan, are now aging. As countries get richer, populations are also becoming older. Disasters would be good because the Philippines is prone to many disasters. So for example, what I noticed in my research that actually communities have no knowledge of the different programs. They are clueless. After every typhoon, they don't know what to do. They were not briefed on anything. That means there's a disconnect between policy and the community. Okay, now where do we publish? Next slide, please. We have a number of journals. Later on, probably in your lectures, you will learn the art of publishing because some are really very expensive. To publish with Lancet, you have to pay $5,000 for an article. To publish with minor journals, you pay $1,500. My journal is free, zero cost. It's BMC, but actually it's not free. We have to pay BMC na 1,000 pounds for every article that we accept. But this will be a more detailed, I can lecture on this in a different topic. So, that's it for my lecture. And the last slide is my email. And thank you for listening. And I think we will have a question and answer portion. Okay, we have a question and answer portion, right? Yes. Okay. This is the only time you can ask me. No, you can email me and we can work on your researches.
Questions?
Do you have any questions?
I don't know anything about research while I'm here.
Okay, question, Don.
Yes.
What would be, you showed us your, patingin nga ulit, yung mga topics, global health topics. Do you encourage collaboration?
Oh, very good question. That's a very good question. Single authored papers are not anymore encouraged.
Okay.
If you will notice, Lancet papers have 1,000 authors. Global burden of disease all have, because all the collaborators are authors. Remember, academic work is very important in the Western world. Therefore, the more authors, the more collaborations, the better.
Okay.
But of course, you have to go through the ethics of writing and collaborating. Everyone contributed.
Yes.
Because everyone just wants to write on with publications. And multi-center studies are more important. So global health journals would prefer articles which come from different countries, and it's more powerful. In fact, for example, if you will notice, in developing countries, the ones who are doing a lot of research are the ones who are from the Western world, but they do a lot of work in the Philippines. We would encourage that the research assistants in the Philippines should be co-authors. Having something, we always say the first few lines of our researches, according to WHO, tuberculosis in the Philippines is XXX. Have you noticed that?
Yes.
Or according to WHO of the United Nations, the population of the Philippines is 100 million. My friends, who collected the data? You think it was WHO?
No.
Of course not. It was you. It's the Philippine government who collected, but your mindset is according to WHO, and WHO has no people to do this. So that is the reason why there's also equity issues in research, because most of our research assistants are on the ground and they are never co-authors. That's why always fight to be a co-author in a paper. Okay? So collaboration is very important. And of course, collaboration is better because you pull in more resources, your findings is stronger, and you have more people who can write together. Kick out those who are lazy. Okay. Any question so far?
Sorry. Sir Don?
Yes.
Hi, I'm Karin. So at this stage of at this stage of the of your talk, we would like to open the floor for their questions for you.
Okay, sure.
Okay, so we have about 20 minutes for their questions. I am pretty sure that they have several questions for you.
Okay.
Okay. So if you have questions for Sir Don, then please address him now because it's hard to catch him in another forum. Are we gonna do the Filipino thing of being silent for a few minutes first? Then, wag ba tayo mahiya kasi sayang yung chance mo to answer down. Well, if you don't have, yes, ma'am? Alright.
There's one, yeah.
Sure, I have a question. I'm Katerina. By the way, I'm from Samar.
Ah, yes, I know.
I was hoping to meet you in Chicago, but I'm here also. So
Very busy.
Yeah, very busy. But anyway, sir, I would like to ask, kasi diba, you are conducting global health courses in Asia, but not in the Philippines.
Okay. We actually did one in the Philippines, the Global Health Course in Tacloban. That was a bit focused on disaster. We can do it if there will be hosts, and I will be happy to deliver the Global Health courses. Even any other lectures, if you want to invite me, as long as you give me enough time, whether it's a research or anything, or I'm into higher education, or pretty much in almost all areas of health, I do it. Just have to compete with the other invitations. And so that I couldn't go to you now there face to face because of busy schedule. But anytime I'll be happy to deliver. Don't worry, I don't charge.
Thank you, Sir Don.
I do equity, by the way. I practice equity. If you are a rich institution, I charge.
Ala.
Oh no!
If it's not very rich, it's free cost. Zero. Yes, I'll be happy to deliver anything if you want to. No worries. Oh, by the way, that thing, the Global Health courses, it's actually a leadership program where we, as I said, we aim at developing critical thinkers. That's what we did today. Critical thinkers, leaders, and researchers in global health. So why do we have to do all of this research from a global health perspective? Because what we want is influence, policy, and practice at the global level. We go to the grassroots, like people like you, to do very good research and bring it to the global level so that we can influence the funders, the policymakers, by presenting your research in conferences and publishing them. And you will say, oh, it's a lot of work, it's useless, people do not read. No, it's not, it's wrong. People, what we are doing is archiving the current health issues so that in the future, whatever you do in Samar or in Leyte or in Mindanao, these data are archived in the journal so that in the future, when we have same issues, we can go back to your research and evidence. So that's one. Another thing is we look at the gaps. So even if you're doing basic research, for example, HIV/AIDS, we can do projections in the Philippines. We still need a lot of researches on that, why there's an increase in that, but no one's addressing. If we know that these are the issues, then we will know how to address the problem in the near future. Okay? Question?
Sir,
I see.
do you do research on disability?
Oh, very good. It's a very good question. I personally do not do a research on disability. I have a research on disasters and disadvantaged population. That would be very good. For example, I just finished the data gathering on the elderly during disasters. We noticed that the vulnerable populations become more vulnerable during disasters. We could only focus on one group, not the disabled or the children, only on the elderly. And there were a lot of narratives that the elders saying that, go ahead, go to higher areas, leave me alone because I will just be a burden, I'm okay to die. Many of the elderly said that. So in other words, the elderly become less priority during disasters. They let go, so many of them died. And I would be interested among the especially abled people, what happens to them during disasters. So it's just one way of focusing. You can when you want to do research on disability, you can do it from a policy perspective, from a health perspective, from equity perspective. It's actually the way you frame your thinking. That is the reason why this workshop is very important, because you have to know what is your research question. Why are you interested in such a question? Do not be ashamed, even if you're. We have we just published a paper now. We submitted why people defecate outside. In layman's term, why do you shit under the trees? That is something which may be, it's not so sexy as a topic in the Philippines. That I would prefer HIV/AIDS but defecation is a major global health issue because that has to do with access, that's wash, access to toilets and services. Simple as just ask your 100 students, ask them and go to the communities, give assignments to 5 of your students, do a survey, ask the poor in rural areas if they defecate outside, look at the variables, age, sex, income, etc. You can make it a very high level research by looking at defecation. It's not sexy, but if you're the one doing it in the Philippines, you'll be in the WHO committee for defecation outside. There are many WHO committees.
Yeah.
But that's okay.
Another?
Wala kayo, ako magtatanong.
Sige po.
I have a question. Kasi I'm a frontline health worker. I'm an MHO. And I've been trying to look for partners who would help us, be able to write or to make our experience translated into something that we could present, to others. I mean, you said that there's a value pala in presenting. Akala ko nun, it's just an opportunity to travel. Pero, may ano pala yun? May bearing pala yun when you are able to present?
Yes. Okay, I'll tell you a secret. How I became globally famous. Joke. Well, I am. In my own way. So, when I was an ordinary person when I was in the Philippines. I met Karen, by the way, in Vietnam. I delivered a plenary. And I noticed my value in the Philippines was actually less value. Government employee working for the Philippine Council for Health Research and Development. When I went abroad to do my postgraduate studies, I learned that if I bring the issues of the Philippines to a wider audience, they listen. Because in any international conference, it should be global and international. There will always be a paper from every country if possible. If you're the only Asian person in a big conference, you're special. Because the conference will have a perspective from your own country. So that's the reason why there's a value in presenting researches in big conferences, because the funders are there, they listen, collaborators are there, they look at your research, and that's why they go to you and then they ask you for your email to collaborate, because you plug in the gap of this country and put it in the whole so that we will see the differences. So we now look at it from a global perspective. So that's the reason why the Philippines has an advantage, because most of the conferences have scholarships for people like you. They give free airfare, travel, if you have a good data. So I've been attending conferences before when I was younger. I try to limit it now. And then that's where you build. You actually serve your country because you are trying to present the findings. The Department of Health people are very busy. You can travel after. That's fine. That's part of traveling. But being able to present it in big fora is very, very important. And people will fund you if you're for example, I was asked by Rockefeller Foundation overnight, we have a $1 million project to look at the informal sector in the Philippines and look at their access to health services. If you're the only one that they know, you will get the contract. And one other thing is, if you know the funders, you know, at the global level, your salary as a principal investigator is at the global level, not at a local level. Therefore, just in 1 month of work, you can buy a car for your field work. People who are researchers, if you do it well, actually get better incentives. Okay, we're doing research not because of the money, but they just come to you. So with the money from Rockefeller, I was able to hire many researchers and it multiplied. And if you are really good in the area, you become part of editorial boards, and it's a powerful position. Being the editor-in-chief of Lancet, you're invited in all conferences because you influence policy and practice. So aside from it being something that is an opportunity, it is also a responsibility to do research and to give good and credible data. Because what comes out in your mouth in a 5,000 people conference is what the media will pick up and which will be said in newspapers. And that's a ripple effect. That's the reason why with the internet, social media, we get a lot of funding on disasters because we produce evidence. So it is a cycle. So do not look at it as a burden. Look at it as something that you do for your country, for yourself, and who knows, you'll be an academician of the National Academy of Science and Technology. When you die, you will be brought to for a state funeral. So this is also partly inspirational and motivational because people look at research. We are a country with 105 million people. But those who are doing good research is not that many, only a handful. Because the problem with our universities in the Philippines is we all teach. Professors in universities in the West are researchers, not teachers. In fact, I teach only one subject in SEM, but in the Philippines, you teach 10. My goodness. How else can you do research? And we don't give incentives to researchers. So going back to your, let's say for example, you are practice-based, you are doing a lot of practice, you produce a lot of paperwork. That paperwork is already a form of data. That is qualitative data where you can do a qualitative analysis, whether it's framework analysis or thematic analysis, and then that's what you convert into a paper. So publishing is very important in the research cycle. Happy?
Yes.
Okay, yes, the question.
I have a
Yeah.
question. Since you mentioned that collaboration is important, collaboration between different disciplines and different countries is important, how do you go around topics that are a taboo or stigmatized or topics that are not, supported by policies? For example, the drug war here in the Philippines. So it's a good topic, especially if different countries would collaborate on how do you alleviate drug addiction. But
Okay.
you know how the administration looks at it. So how do you go around? How do you mobilize people when there is stigma on a topic, or if it's not supported, or if the administration is against it?
Very good question. Okay, one, drug problem in the Philippines is number one. It's a big topic in global, focusing on the policies of the Philippines on drug addiction. So if you scan journals, there are many publications coming out, but not authored by Filipinos. That's one. Two, ethics is very important in research. Always do no harm to the population. And of course, do no harm to yourself also as a researcher. Okay? So do not put yourself in harm's way. there are many ways, innovative ways to do research on drugs. For example, my example of research is on risk-taking, sexual risk-taking behavior of seafarers. I was in the brothel area in Brazil for 1 year. A brothel area, a red light district, is a very dangerous place because the drugs from South America, they will talk to the seafarers so that they can carry the drugs to other countries. That's a very dangerous. And people will not talk about whether they use condom, how they did sex the night before, if they used condom or not, and what were the actions, if they were happy, what noise they did. If you think that people do not answer, actually they do, and they love it. So in any research, whether it's death or some taboos, for example, menstruation, no one does research on menstruation in the Philippines, when in fact it's a very, very important teenage health issue all over the world. You can always have a way of asking questions, going through different ways of getting into the population, from the gatekeepers. And of course, it's a relationship between the researched and the researcher. So it's always a relationship. That's a reason why you're able to get the data. So it's an interesting way of navigating it. And by the way, while you are doing the research, you can also research while you are doing it, so that you will have more papers. For example, a navigating research on drug addiction in the Philippines, a researcher's dilemma. Or a gender dimension of doing research on drug addiction in the Philippines, a feminist perspective. You see, you can be creative. So my answer to your question is, there will have ethics. There are innovative methods and ways, because you know what we think of most of the time is always, oh, let's do in-depth interviews. Oh, let's do a survey questionnaire. There's beyond that. There are many things that you can research on. But remember, the important part of such a research, especially if it's policy-oriented, is policy dissemination. Have a policy translation, conferences, seminars, present it with policymakers, present it with the Department of Health, present it before Duterte, for example, and tell him your findings. And then it influences the policymakers, because one of the major issues of research is the criticism is always just put them in desks and no one read them. So you also have that dimension where you have to properly disseminate research by presenting it in anywhere where they will listen, even translate it to media or learn policy briefs. So maybe one of the sessions in the future, we can do a policy brief session writing. Okay?
All right.
Question?
Sorry, we can only accept last one question. We have been making Dr. Don speak for nearly 2 hours now. So, last question for speaker. None? All right. You have a question?
Yeah, kasi if I'm not mistaken, you said a while ago that cultural aspects is not part of the global health research. My concern is how could we be intact with the minorities of one group, like if we're not going to touch on the cultural aspects itself, or how are we gonna make the idea global if we're not going to touch on that?
Oh, okay. Sorry. I think I didn't give it a good explanation. I didn't say that it's not a global. It is still a global aspect, a global dimension. For example, you want to do a comparative analysis of the cultural aspect, determinants of menstruation, menstrual hygiene among young people in Africa and, let's say, in Cameroon and in the Philippines. You are looking now at the different cultural dimensions, but because you put in a bit of a global perspective, then it becomes a global health research. Okay? But in itself, as let's say, for example, you're just looking at cultural let's say, cultural determinants of defecation in Romblon, that will not be a bit saleable to a global health journal. That's what I'm saying. So it's also the way you frame your research that it becomes a global health aspect. So if you put together two data from a researcher in Malaysia and the Philippines, that will be a bit of a global dimension. Example, Ebola virus. Why did it spread? Because they washed the dead. So in Sierra Leone, Ebola, which spread in the region, that's why it became a global health issue, because one of the practices is they wash the dead. What do they do with the dead after washing? With the water that they wash the dead with?
The river.
They don't drink it.
Bathe.
You wash it on their bodies also.
Oh my God.
And the virus transfers from the dead person to the living person because they have a belief that the soul of that holy person will transfer to the children and the rest of the family. That's a global, that's a cultural perspective of a disease, why it transfers. But of course, when you write it, when you frame it from the introduction, you say that Ebola is a major global health issue because it moved from one country to another. But based on my conclusion, there are different determinants in two countries which we studied. It's actually the beauty of writing. So writing is your papers. What we do in writing is we're mostly positivist. We say 20% of the population are females, 80% are males. Out of this 80%, 12 are smokers. When you write, make it more very analytic, and that's why it takes iteration when you write. All you have to do is always beat the deadline, one writing, and you just submit. No, it doesn't. It takes a number of writing to make it perfect. And do not plagiarize.
Yes.
Where are very, very powerful. You plagiarize, you are dead.
All right. Wow, that was a really great talk from Dr. Frisno. The third, we have to remember the third. And I think we've all learned a lot about global health. When we were drafting, sorry, Sir Don can't see me. There. When we were drafting, hi, there.
Yeah, I can see you.
When we were drafting the program, immediately what came to our mind was that, of course, we have to have a global health point, and we said, I said, that's gonna be Dr. Frisno immediately. I watched his talk in Vietnam, and it's gonna be him. But the problem is, how do we get him here? And so we are very privileged that he agreed to do this with us. And yeah, so I think at this point, please join me in giving a round of applause for Dr. Frisno. We are recording this video. Would it be okay with you that we will upload it in YouTube?
So, okay, what she's doing now is what you call verbal consent.
Yes.
Informed consent.
Yes, fine. That's fine. I'm okay. I'm okay with that. It's more for the learning of the world.
Yes, exactly. Thank you so much, because a lot of people would like to access this, because we limited the slots to 20 people because of logistics. So we would have wanted to have more people to attend this. So we're gonna make this apparently a yearly thing, and hopefully next year you're in live presence when you deliver your talk.
Sure. Okay. So thank you very much for the invitation. I'm always happy to. Actually, I'm very happy because one, this is my very first time to be invited by the University of Santo Tomas. No one invited me from the Philippines.
Oh.
All they invite me except the Philippines. I will really be very happy if we produce more very good researchers in the country. So in that vein, I would be happy to work with you. Don't be shy to email me, to publish papers with me, and we can work together. It might take time with your work, and I'll be happy to communicate further with every one of you. So you have my email, and thank you very much.
All right, thank you, sir. It was to put in some more theories, right? At one point, I asked Edlin, what the heck are you guys talking about? Because I think we were talking about capitalism and cars already. So it's very important what he was doing to put in some theory into this, primarily because, stop eating. Primarily because social health is heavy on theories. I know for those of you in allied health, you're heavy on, well, you're also in theories, but mostly you're building facts. In social health, it's hard to create facts as in facts because we are dealing with narratives, with human stories. And since we're dealing with human stories, there is no such thing as a 100% fact, nor your, one important idea as well to remember is that even your theoretical orientation is a bias in itself, right? So I'd like to add one point to what he was saying. He said, how do you make one discussion global? What you have to do is compare cultures. That's one way. Another way is by looking at international events that affect a local place. That makes it global. For example, you could look into, for example, I'm at loss now. Now I'm gonna go to tuberculosis. For example, tuberculosis, and you can look into how global factors of, let's say, WHO giving in the global fund, how people are forced into poverty because of demands from a stronger country. This is a theory called political economy. I'm a heavy user of political economies. Why? Because it situates localities. It situates localities in a bigger framework. The truck driver who had sex with a person in prostitution, it's not just having sex with a person in prostitution without condom. We have to ask first, why is he even having sex with that person in prostitution? And then you're going to go, oh, because he doesn't see his wife. Why is he not seeing his wife? Because there's high demand for labor. Why is there high demand for labor? Because there's the neoliberal capitalistic agenda. That is what he was pointing at a while ago. That you have to see it on a macro level sometimes. A small thing in the community can be seen on a macro level. Right. All right. At this point, lunch is ready. That's what we do here. We teach you, we feed you, fatten you. We don't do exercise here. So we're gonna have lunch, and that's gonna be until 1, so that you could just, reboot. Because I feel like if I just give you 1 hour of a break, sleepy time is the problem. So when you come back at 1 p.m., we're going to have the discussion in syntax law, more on health economics. I was told by the speaker who said, why did you put syntax law? Put health economics. All right, health economics. And then after that, you're going to have me for qualitative research design and methods. And then after that, we're going to have the workshop on cell phone ethnography. All right, very good. Cell phone, that's the specialization of Mr. Fred Priscillas. That's his master's thesis. He's not yet a PhD, but this guy has lots going on for him. He did an alter. He's gonna introduce himself, but he did some, the alter accounts in Twitter.
Yeah.
Wow!
Yeah.
You know why I'm saying wow? Because we have finally seen the generation gap in the participants. Those people said, "What's that?" That's from a different generation. And those of us who said, "Oh yeah, we know that." Yeah. So he studied that. It's an interesting. He's gonna discuss that a lot when he talks. So cell phone ethnography. We all have our cell phones. It's gonna be fun. All right. Please have your lunch. For those who have not signed up, please sign up. Please do not disappear. Yes.